Good morning, ladies and gentlemen. My name is Paredes-Mogica from Anahuac University at Mexico City. Big thanks to our two moderators and to our collaborators at Massachusetts General Hospital and Stony Brook University. We will now talk about our paper, which talks about that chronic pelvic pain patients with urodynamic autonomic dysfunction may have underlying small fiber polyneuropathy. Our affiliations to disclose include that of Dr. Des, which is working as a consultant in library. It is self-funded. We have no other affiliations to disclose. Patients with chronic pelvic pain suffer from 2.4 comorbidities on average. We all wonder why this occurs. In patients with more diffuse pain and multiple pain syndromes, a systemic neuropathy should be suspected. This neuropathy can also affect this autonomic nervous system. And as we previously published, 64 of our patients with chronic pelvic pain suffer from small fiber polyneuropathy. Pain and autonomic dysfunction are present in these patients to varying degrees. Disturbances in the small somatosensory nerve fibers, which deal with nociception and thermal perception, can lead to cold-like pain, electric-like pain, and allodynia, while disturbances in the autonomic nerve fibers can lead to dysautonomia. In small fiber neuropathy, bladder dysfunction, which includes atonic bladder and bladder neck obstruction, can result from dysfunction of these autonomic nerves. Other symptoms, such as migraines, orthostasis, gastrointestinal symptoms, motility issues, and tinnitus or allodynia may be present. This image, courtesy from Dr. Khosrow Farhad, is an image of a skin biopsy from a patient with no pathologies at all and a patient with chronic widespread pain. We can see that there is a loss of epidermal nerve fiber density compared to a patient with no pain at all. Diagnosis for small fiber neuropathy should include autonomic function testing. This testing may include monitoring heart rate changes during deep inspiration and during the Valsalva maneuver. Other more quantitative tests include the pseudomotor response, which may show some abnormal sweat production. Our study investigated the clinical association of autonomic dysfunction, which included underactivity of the bladder and primary bladder neck obstruction, on video urodynamics. This testing was done in patients with complex pelvic pain with small fiber polyneuropathy. Of 55 patients with complex pelvic pain, a final set of 32 female patients had a complete set of data. This included high-quality video urodynamic testing with full subspecialty autonomic neurology evaluation. Of the 32 women who had undergone subspecialty evaluation, 23 patients were small fiber neuropathy positive, while 9 patients were small fiber neuropathy negative. Small fiber neuropathy positive patients were more likely to demonstrate autonomic bladder dysfunction, either bladder neck obstruction or underactivity of the bladder. The overall risk was of 9.5 with a p-value of 0.007. These are descriptive statistics for the 23 women who had small fiber polyneuropathy. They mirror a recent paper published by Walker et al., where they analyzed the urodynamic findings in patients with postural orthostatic tachycardia syndrome. In our findings, 50% had bladder neck obstruction, 30% had underactivity of the bladder, and overall 83% had autonomic bladder dysfunction. Straining was also a common occurrence. Of the 32 women, we analyzed a subset of patients. We took out the patients with underactive bladder. This was done in order to better look at patients with only bladder neck obstruction. The remaining subset of patients were 24 female patients. Of these 24 patients, 16 women were small fiber polyneuropathy positive, while 8 women were small fiber polyneuropathy negative. Patients with bladder neck obstruction and video urodynamic testing evaluation did not quite have an increased likelihood of small fiber neuropathy on subspecialty evaluation. The correlation was not quite significant, which may reflect our small sample size. Our findings mirror that of previous research, in which small fiber neuropathy is present in 2/3 of patients with complex chronic pelvic pain. A cause can be identified in 40% of patients. Identifying small fiber neuropathy in these patients can provide validation and new treatment strategies that can be attempted. Small fiber neuropathy in women with complex pelvic pain is associated with autonomic bladder dysfunction, which may include underactive bladder and/or bladder neck obstruction. Patients with complex pelvic pain, refractory or multisystem pain should be afforded a low index of suspicion for diagnosis and treatment of small fiber neuropathy, particularly if bladder neck obstruction or underactive bladder are noted on urodynamic evaluation. These are our references for the presentation. Thank you very much for your attention, and may you have a nice day.